Hi, my name is Christian. I am going to be doing the Ngtube insertion demonstration video. So the things that we're going to need for this demonstration uh, is going to be obviously a pair of gloves, a pen light. We're going to have the stethoscope that's right here. And then we're going to have the 60 ml syringe, a basin, lubricating jelly, tape. Of course, we're going to need the Ngtube tubing. Also a wash bin or emesis bin. I'm just using this glass thing. And then also the specimen cup. Now I don't have one, so I'm just using a glass cup. I also don't have the pH indicator strip. I'm just using a Band-Aid and I labeled it pH indicator. And then also this cloth. This cloth that's gonna be used for the patient to provide on the chest. I'm just gonna put it right here. And as far as the supplies, I believe that's pretty much it. So now starting on to the procedure. First things first is we want to check the physician orders before we go inside the patient's room. Typically the physician might order like a suctioning apparatus, which we are not going to be using for this demonstration because the physician did not order that order. So we're going to skip that part. So now moving on into the patient, we're going to greet ourselves towards Mr. Smith, and then provide hand hygiene. We are going to don on our gloves. We're going to introduce ourselves to Mr. Smith. Hi, my name is Christian. I'm going to be your nurse today. I'm going to be doing the Ngtube insertion on you. This procedure is pretty simple. It just requires this tubing that's going to go through your nose and down your throat into the stomach. This is just to assist in feeding so you can get proper nutrition. Okay, so now that I have explained the patient what procedure we're going to be doing, I'm going to check two patient identifiers, name and date of birth, which checks out well. So we checked the two identifiers. Don gloves, hand hygiene. Now we're going to provide privacy. So now that we provide privacy, we're going to want to raise the head of the bed. Raise the bed up towards our level. And then also have the patient come into a high Fowler's position until they're comfortable. So patient is in high Fowler's position. And now we should be able to start inserting the tube. So we are going to check Mr. Smith's nostrils. Okay, left and right nostril is patent, no occlusions, no discoloration or scarring. That is good. Now we're gonna test the airflow and which nostril has better airflow for the tube insertion. So inhale, exhale, inhale, exhale. Okay, so the left nostril has better airflow, so that's the nostril that we're gonna go with. Alrighty. Okay, and while we were waiting, I had the Ngtube inside the basin with warm water, so now it's a lot more malleable. Okay. Okay, we're gonna measure the Ngtube from the tip of the nose to behind the ear down to the xiphoid process, and we're gonna see how long it is. Okay, so here, behind the ear, down the xiphoid process, which measures out to 50 centimeters exactly. So we're gonna make a little marking if there is no markings on the tube, which this one it is, so I'm not going to label anything because it has 50 centimeters right here. Okay, so the way we're going to insert the tubing is that we're going to insert on the bottom of the nostril towards the ear and down the oral pharynx. So first, and then we're going to want to insert with the natural curvature of the tubing. So first we're going to insert it with lubricating jelly for smoother insertion. Okay, we're going to have the patient hyperextend as well as hyperextend their neck and lean forward as we are inserting. So, to insert. Okay. Now that we have reached the oral pharynx, this is typically when, at this point where there will be gagging inside the patient, or the patient will have a sense of gagging or whatever. We're going to want to have the patient swallow, and then we will insert 2 to 4 inches at each swallow while maintaining hyperextension and leaning forward. So swallow, 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 swallow. We want to give the patient a couple pauses, making sure they're okay, that there's no pain or anything like that. Mr. Smith is okay, so we're going to continue. Swallow, swallow. Okay, now we reached 50 centimeters. At this point, we're going to want to tape the NG tube towards the face right here to confirm placement, to have the right hold. Okay. Alrighty. Now this is where we're going to get our 60 ml syringe and the end of our NG tube. So we're going to want to, the 60 ml syringe, we're going to want to retract and get 30 mLs of air. Now that we have that, we get the end of the NG tube. We are going to kink, unclamp, insert, and then insert the air, and then unkink, and then we are going to withdraw 5 to 10 mLs of gastric content. We have got that now. We're going to kink, withdraw, clamp. Okay. Leave that there. Put this down. We're going to tape our NG tube to the patient's chest, just like this. Okay. Now we're gonna swish the gastric contents, stir it up a little bit, and get our specimen cup. We're going to insert the gastric contents inside the specimen cup like that. Put this down. Get our pH indicator. Put it in here to confirm that we have the right gastric contents in here. So that's done. We're going to put that to the side. Now we want to confirm placement. We're going to do this by calling the x-ray people to come in and perform x-ray and to make sure that they have Mr. Smith has the correct placement for the NG tube. So we're going to call them. X-ray has been performed. It is confirmed. Placement is good. Now this is where if we had physician order for suctioning, we would set up the suctioning apparatus. We would make sure that if our tubing, if there's patency in all the lines, making sure that it's a closed system, because if there's suctioning and there's an open port, we won't get proper suctioning. So everything must be closed. We must ensure that. But it's closed and we don't have an order for the suctioning, so we're going to leave it like that. Alrighty. Lastly, we are going to do the plan of care. So normally for the plan of care, I'm going to want to make sure there's patency on the lining of the tubing. And then also I want to note the type of drainage, the amount of drainage, the coloring, any kind of observations of things of that kind of nature. And as far as my documentation, I want to focus on how well the patient responded towards the procedure. I want to describe the type of procedure that we performed, and I want to document any types of findings that I found within the procedure. And yeah, and also want to inform the type of care that I provided. So pretty much let them know what I did, how well Mr. Smith responded to it, and the type of things that I did. Anyways, that's pretty much it. So remove gloves, put that down, hand hygiene, say goodbye to Mr. Smith, and that's it.